Hi, and welcome to Health Talk. I'm Jay Noreen. Most of us trust our doctors because, of course, we know them well. But you know, almost as important as knowing your doctor, we should know our health insurer. Now, how do you get to know a giant health insurance corporation? Well, it can start right now as we take you inside our largest health insurer in North Carolina, Blue Cross and Blue Shield of North Carolina. Meet Brad Wilson, President and CEO, and an Appalachian State alumnus. Brad, welcome.
Good to see you, Jay.
I just wanted to congratulate you on App State having the good judgment to honor you with a doctoral degree this past May. Congratulations.
Well, thank you very much. It was quite an honor, and I was most flattered to receive it.
Well, App State showed good judgment in honoring you that way. Well, again, thanks for joining us.
Sure.
This is a very special topic. You know, health insurance and how it affects our daily lives is something we all need to understand better. And so we, of course, need health care at various times, and almost all of us do so through our health insurance programs. But I think it's fair to say, I would say this even about myself as an internist, it's fair to say that, you know, most of us really don't fully understand how health insurance works. So you're here to teach us, and we really appreciate it.
Well, I'll do the best I can.
So could we start just by learning a bit about Blue Cross Blue Shield of North Carolina?
Sure.
But a bit about the company.
Sure. Well, the corporate biography goes like this. Blue Cross Blue Shield of North Carolina is the state's oldest and largest health insurer. Been around since the early 30s by different names, but the current name came together in the early 70s when a Blue Cross insurance plan or company combined with a Blue Shield company came together, forming Blue Cross Blue Shield of North Carolina under a not-for-profit structure, but fully taxable. And in the business construct is you do need to make a profit. The old saying is no money, no mission.
Yep.
But since that time, Blue Cross Blue Shield has continued to grow. We currently serve 3.9 million customers in our state, including customers that may be insured by another Blue Cross Blue Shield in the country who lives here in North Carolina. Last year, we were about $8 billion in revenue, and we paid approximately $6.5 billion in medical claims on behalf of our customers, paying for the goods and services that our wonderful provider partners offer. We have about 4,800 employees. Most of them are located in the Durham, Chapel Hill area, but we have employees across the state. And in fact, more and more are working from home, which expands our employer footprint. So that's essentially who we are and who we've been.
Well, so you actually now are in the world of telecommuting with some of your employees.
No question.
That's
Absolutely.
very
We have
impressive.
about approximately 750 employees who do most of their work from home. So they live in Salisbury and Concord and places that you typically wouldn't find an employer-employee relationship because you needed to live in the neighborhood, so to speak.
Yeah. So it's a different world in that regard.
Absolutely.
One of the things that I know, I've had friends who've asked me, is okay, now around the country there's Blue Cross and Blue Shield. What's the difference between Blue Cross and Blue Shield? Lots of states have that same depiction.
Well, today the way you need to think about it is that that's a brand, that's a label. And in some states, like California, for example, the Blue Cross and the Blue Shield companies existed historically separately. They've just never come together. But the products and services that are offered by each of them are essentially the same. One thing that makes Blue Cross Blue Shield work well is what's called the Blue Card system. So if you have a Blue Cross Blue Shield of North Carolina card, it works anywhere in the world. And we process the claims invisibly to the customer or to the patient. So we are all together under one big umbrella, an association. And we have a licensing agreement with that association here in North Carolina that says we can sell health insurance under the Blue Cross Blue Shield brand anywhere within the state of North Carolina.
Okay, so it's a historical thing more than anything.
Yes.
Now it's all one company.
That's essentially the way. Well, think about it like a franchise.
Yeah. Okay.
And so yes, but we are coordinated from a service perspective. We share lots of IT back office capabilities and policy and that sort of thing. But we are an independent Blue Cross Blue Shield of North Carolina is an independent licensee of the Blue Cross Blue Shield Association,
Okay.
which is headquartered in Chicago.
Okay, okay.
That's how it works.
Now, one of the things that I think people don't understand is, what's the process for going and getting insurance? Blue Cross has people who provide access to buying an insurance plan. How does that work? Can you talk about that a
Well,
little bit?
I'm going to give you a bit of a lawyer's answer. It depends.
Yeah,
but
okay.
let's clarify that, because it's a very good question. Think about it this way. About 48% of North Carolinians who have health insurance get that insurance by virtue of being employed. So their employer provides health insurance coverage, either pays for it all or some portion thereof. And so long as you are employed within that circumstance, then you will have coverage. Sometimes the employer says it's just for the employee, and sometimes the employer will say, well, you can add on your dependents, so your spouse, your partner, your children. People who are not employed such that they get insurance, they can purchase individual coverage on the market, in the open marketplace. And I know we're going to talk about the ACA,
Yeah.
but that's what the ACA, the Affordable Care Act, is all about, is providing individual coverage to people who do not otherwise have it. So you can purchase it online, go to Blue Cross Blue Shield of North Carolina and get a quote and interact directly with our company. But the bulk of our business is actually sold to customers through brokers and agents around the state of North Carolina. A very strong, long-standing relationship with the broker community, and they provide valuable services to their clients. And so those are the traditional aspects of how people get covered. Now, you also have the government programs, Medicare, Medicaid, and there are other insurance companies. We have 5 ardent competitors in North Carolina, and people can choose to purchase their insurance coverage through them.
Sure. Now, so I'm looking for insurance, and there are brokers I can go to. How would that work? I'm going to go to, how do I find out where there's a broker? And then when I go, how am I going to interrelate with that broker? Because I don't know a whole lot about how health insurance works.
Well, most brokers certainly are online. So most people today, or you can get the yellow pages out metaphorically.
Yeah.
And if you're specifically looking for a Blue Cross Blue Shield product, you could Google Blue Cross Blue Shield of North Carolina and your zip code, and up would pop the agents that are close to you that are having an arrangement with us that gives them the right to sell Blue Cross Blue Shield policies. They may also sell some of our competitors. So it'd be a personal contact. If they have capability online, you could probably get a quote. Like I said, you can certainly get it to us fundamentally, give some statistics and get an approximate quote. And then you could pick up the phone and call the 800 number, interact directly with one of our direct sales agents. You could go down the street to your favorite broker who's selling health insurance, and out of that conversation would come an analysis of what you need and what it is that you're looking for, and then certainly match it up with a price point that is affordable for your budget.
But let's say I'm a 27-year-old, and therefore I lost my insurance from my parents because I'm now 27, not 26.
Right.
And I'm not employed, I'm looking for a job, but I know I need insurance. Can I go to a broker and sit down and say, hey, help me figure this out?
Yes, you can.
And how would that go? How would that interaction go? Because the average 27-year-old, for that matter, 65-year-old, is not real good at understanding that what the options are.
Well, you've asked the fundamental question. I mean, just coming in and being honest with whoever you're asking for assistance. I don't understand anything about this. I need you to give me the Health Insurance 101 lesson.
Yeah.
And let's walk through it together too. I've done a little research. I think this is what I'm looking for. This is what I think I need. The 27-year-old who's unemployed and out looking for a job, my advice to them would be either do that, and in addition, you can access the federal exchange through the Affordable Care Act. And there is information there that teaches some fundamentals and then how to process through the Affordable Care Act, because in that circumstance, they would certainly be entitled to a federal subsidy to help them pay for the premium for the product that they ultimately would select. And in that context, relative to ACA, think about the products like a menu. And they are apples to apples. So there are 3 companies on the federal exchange here in North Carolina, Blue Cross Blue Shield of North Carolina, and 2 of our competitors. We are the only company that covers all 100 counties. Our 2 competitors are only available in certain counties in the state. But all that information is there, hopefully easily understandable and digestible, that would begin the process of education where people can make smart decisions.
Now, when I'm looking at those alternatives, what are the main things I should consider as this 27-year-old, or for that matter, 50-year-old who, suddenly lost their employer health insurance?
Sure.
What are the things I should consider? What are the key elements?
That's a great question, and unfortunately we find most consumers do not approach the purchase of health insurance just like they would an automobile or a big screen TV.
Yeah.
But the thought process is essentially the same. What do I need? What do I think I need? What can I afford? What doctors and hospitals do I want to make sure I have access to? And where are they? What is the depth and breadth of the coverage that I'm going to want? Now here's just a bit of a nuance. If you're purchasing your insurance through the Affordable Care Act, i.e. the federal exchange, all of those policies are going to look the same and the coverage is going to be identical. Because under the federal law, they must be. So you're going to get a very rich benefit plan, covers lots of stuff, including preventive care, which is important to all of us, but I would say to our 27-year-old friend, is important to them, even though they might be enjoying very good health and hadn't been to the doctor in a long time. But you would go through those kinds of considerations, making sure that you have the right coverage for the circumstances that fit your health status, and that you're going to be able to access the medical services that you're going to want when and if. It's not a question of if you're going to need them, it's just a question of when and how you're going to need them.
So some plans limit the physicians you can go to.
Yes.
Others not so much.
Correct.
And so that's one factor.
That's right.
And then, of course, the premium is a factor, and that depends on the type of coverage.
Right.
And now the 2 things that keep coming up when you're going on to a website, and I've done this for my son, for example, is deductibles and coinsurance.
Right.
How do you convey to the 27-year-old who doesn't know what that means? How do you convey what that means?
Well, just think about it in these terms, and we need to keep this simple, so there are always uniquities that would change the answer. But that's how much you're going to pay. That's how much comes out of your pocket. Either over the year that you're covered under that policy, so it's cumulative. Once you spend $1,000 out of your pocket, then after that, the amount that you're going to have to pay is much, much less. Or coinsurance is what is going to be your contribution at each visit. Because there's a coinsurance component to that. For example, under the ACA, certain services that you would receive at your physician, under the law, there cannot be any copay. So it's a 100% coverage process or activity at that point. Remembering, however, it always shows up in the premium. Somehow, some way. I mean, it's amazing, Jay, as you travel around talking to people, and they'll say, well, under the ACA, preventive care is free. Well, it's not free. It's costing somebody something somewhere because it's embedded in the premium. You may not have to make a copay at the time of that service because of the definition, but the cost does show up somewhere in the whole economic construct.
So if I'm looking at, and I know it's more complicated than this, but if I'm looking at 3 things, my premium, what I can expect for deductible, the amount I'm going to have to pay out of pocket for a service, and what my coinsurance, what % of it I'm going to have to pay, is it a reasonable thing to say you pay a higher premium, you're probably going to have a lower deductible and a lower coinsurance. You pay a lower premium, higher deductible. So there's a little bit of gambling going on. I mean,
exactly.
If you want to pay a lower premium because you don't think you're going to be that sick, and so you'll probably have a higher coinsurance and deductible if you get sick. And so the 27-year-old might kind of be more oriented that way, whereas the 62-year-old might say, I'm going to pay more because then I don't have to pay as much deductible.
Well,
is that a fair?
That is exactly right. And you see that in the analytics. That's the way it works. Typically, the younger and or the more healthy folks are inclined to purchase a lower premium, higher deductible type of a policy than those that are confident that they're going to need lots of services.
Yeah.
And the trade-off, the economic trade-off. You can really think about it the same way you do your automobile insurance.
Sure.
I'm a safe driver. I'm not going to have a wreck.
Yeah.
And I'm not worried about the collision coverage. So I'll $2,500 on collision deductible is fine for me. And I'm a safe driver, and I've got a good driving record. So you'll pick a lower, you'll pick higher deductibles and a lower premium. Health insurance works the same way.
Yeah.
And so there's art and science to it.
Yeah. And for that person buying an individual plan like that 27-year-old or whatever, it's important to understand these interactions. And I think the average 27 or even 60-year-old who is doing this for the first time doesn't. And so that's where the broker might become pretty important. Or in the Affordable Care Act, they call them navigators. They're kind of like brokers, only mostly for information.
Right. Trusted sources.
Yeah.
And they exist in lots of places. I mean, some people might be your parent, might be your brother, might be your spouse, whatever. But the point is this. I would encourage people, because let me say it this way, Jay. I'm sorry to stumble around. As health insurance evolves, it is going to become more and more individual based. It's going to become more consumer oriented. As individual consumers, we are going to have to take ourselves to school on the complexity and how health insurance works and how medical delivery systems work in order to be able to make the kinds of judgments about the health insurance policy that you're going to need and want, when and how to access care, because we always want the highest quality at the best price, not necessarily the lowest, but the best price. It's a value proposition. And so that whole consumer orientation about thinking about health insurance and health care and the whole health care ecosystem in that way is going to be very, very important. So seeking out those people who can provide you the kind of advice and guidance that you're going to need. And we're seeing very clearly that the brokers who are becoming those trusted advisors in the marketplace are continuing to enjoy good success in the business that they have built and the value they want to bring to their customers. That's our philosophy at Blue Cross Blue Shield. We want to be that trusted advisor, and we're happy to provide as much information as we can to help people make the right choice for them.
Well, so you mentioned the Blue Cross Blue Shield website. So if I'm looking for information, is that a good advisor for a starting point?
Yes.
To just go to that website and start asking questions?
Right.
Is that a reasonable thing to do?
Absolutely, go there. One thing that we did, you might find interesting, is that the first of the year, we were the first health insurer in the country that we simply published and made available 1,200 prices of medical services by institution and by practice. You don't have to be a Blue Cross Blue Shield customer to access that information.
Okay.
That's what made it, one of the things that made it so unique. So more and more transparency in how insurance works, what the actual cost of goods and services are, will be a fundamental information point that consumers are going to want to see and know.
Yeah.
So if you have a high deductible plan and you know that driving one more mile down the street, you can access a very high quality provider who charges $500 less for whatever that service is, that mentality and that consumer behavior is already taking place.
That's very encouraging, because I think one of the things that a lot of us have experienced is you don't really know how much things cost.
Right.
And so you're not really making a judgment about what you're buying.
That's right.
And so that kind of 1,200, that's an impressive number
And
of
you can-
things you can look up.
Well, exactly. And just go, again, part of education, just go look and look at the price differentials.
You may have some people coming to Blue Cross Shield's website soon.
Well, we hope so. And we hope you learn something when you do come.
Yeah,
So,
yeah. Well, the Affordable Care Act is a big deal. And I think, the average person sees TV reports, news reports about it. Can we get, from your point of view, a quick summary of what the Affordable Care Act actually does? And I know it's a 1,000-page law, so it's not simple, but just
That's
a few high points?
That's right. Well, first of all, when you get to page 1,000, you've only got 1,400 to go before you actually get to the last page. So there's a lot in there. But I would encourage us to think about the Affordable Care Act this way. It is providing standardization of coverage for those that are buying their health insurance through the federal exchange or through a state exchange. We do not have a state exchange in North Carolina. Through a state exchange, through the federal exchange, which is the mechanism by which the purchase decision is made. That's how you enroll, and that's how you get your coverage. That mechanism calculates what it is that you must pay out of your pocket and what the federal subsidy will be, which together would then pay the premium for the product that you have selected. So the ACA makes health insurance available to more people. As we sit here today in year 2, some 16 million Americans now have health insurance that they purchased through the mechanism of the federal or state exchange under the ACA. So let's think about it that way. It is a marketplace. It attempts to bring, again, standardization to what it is that you buy. So if you're looking at a bronze plan, which is in the cheaper category on the ACA at Blue Cross Blue Shield of North Carolina, and you're comparing that to one of our competitors, it's an apples to apples comparison from a benefit standpoint.
Because the benefits are standardized.
That's right. Now the price may be different.
So you're buying a Ford from both places.
That's exactly right.
Yeah.
And it's going to have air conditioning and all that sort of
all
thing.
that's specified there.
That's right. And there are levels. So bronze, silver, platinum. And as you go up, the more expensive it gets for
And the
a
more
variety of
coverage.
reasons. That's exactly right. Here in North Carolina, after year 2, we have some 563,000 people that have their health insurance through the ACA.
So those are
mechanism.
newly insured that weren't insured in all
Well,
of it.
not entirely. Some
Okay.
people had insurance
And moved. Sure.
But all in all, yes, there are people who never had insurance before.
Yeah.
There were some who had insurance that they either couldn't afford or didn't like for whatever particular reason, that have moved into that, making that purchase decision and acquiring their health insurance through that. North Carolina's in the top 5 in the country of people who are now insured through the ACA.
Oh.
And we believe that that's through the good efforts of lots of people in our state who've been trying to educate folks that it's there, what it really means, and trying to get more people into the healthcare system by virtue of having coverage. And that indeed is happening. Now, we still have about 1.5 million people who are uninsured.
Yeah, okay.
Completely. They're not covered by Medicare, Medicaid, or any private commercial insurance.
Yeah. But now, as I understand it, correct me if this is wrong, since the ACA, the percent of people who don't have health insurance has really gone down pretty substantially, nationally and in North Carolina.
That is correct. It has gone down. So I think it's a good data point. It's not quite this simple, but there are 16 million Americans who now have health insurance that might not otherwise have had it.
Yeah.
And that's a big number. There's still plenty more who need to access it or access health insurance through some mechanism. Medicaid is one way. Medicaid expansion or the lack thereof is also a factor in that. And then as those of us who are getting more and more mature, getting closer to the magic Medicare age of 65, of course that is available. And here in North Carolina we have a growing Medicare population because we're an attractive state. We are growing in population and people are choosing to retire here.
Yeah. Well, this is a complicated area, but I'll tell you what you've been telling us has really been informative. We want to have you come back another time, and because there's more to learn. There's Medicare and Medicaid, and a lot of us don't know about that. But we hope you can come back.
I'd love to do it.
I think that what is important for us to understand is that access to health care and health insurance is something that affects all of us. And so when fewer people are without insurance or more people are with insurance, it affects all of us because the healthcare industry does treat people when they come to the door, whether they pay or not.
That's correct.
So if there's more people insured, it kind of helps all of us.
That's indeed.
But we need to learn more about this, Brad.
Well, I look forward to our next conversation. Thank you for the opportunity.
We will do it, most definitely.
Thank you.
That's our program for this week. You can learn more about us at watchapptv.com, and I hope you'll join us next time for Health Talk. I'm Jay Noreen.